What's happened to my child? I don't understand the sudden change in my daughter's behavior. She's become extremely angry, isolated, anxious, and has horrific tantrums. She's unreasonable and just doesn't seem to get it. I don't even know who she is anymore. She's empty, has huge pupils, and looks with a blank stare. It seems like she's looking right through us. She's hyperactive, her mood swings by the minute. We don't know which side of her we'll get. It's difficult for our family to continue walking on eggshells. I don't understand why her pediatrician can't seem to help her.
What's happened to my child? Why is my child suddenly washing his hands 20, 30, 40 times a day? Why does he suddenly need to touch or tap on everything near him? Why is he repeatedly moving his hands, arms, and head in a pattern? And why can't the psychiatrist seem to help him?
What's happened to my child? Why is my son Greg suddenly acting so bizarre? His movements and compulsions are completely out of control. He's twisting his torso nonstop, blowing out as though he's having an intense workout, giving himself whiplash with his head spinning, losing his glasses and dropping his books. Often he has loud and frequent vocal tics, or uncontrollably sticking his tongue out hundreds of times a day. Every day, the symptoms are becoming more and more severe, sometimes even dangerously severe. Why can't my son's neurologist seem to help him?
What's happened to my child? Why is my child becoming more and more afraid of things, having panic attacks and eating problems, and sensitivity to things like clothing, noise, and light? Why does he suddenly have separation anxieties, sometimes screams for hours on end, and even wetting his bed? And why don't any of the medications and treatments he's taking seem to help? Is there any answers out there? Is there anyone who can help?
Maybe the problem is none of the above. Maybe the problem is PANS, Pediatric Acute Onset Neuropsychiatric Syndrome, formerly known as Pediatric Autoimmune Neuropsychiatric Disorder Associated with Strep, or Pandas, was first recognized by doctors about 13 years ago. Researchers theorized that PANS could be responsible for up to 25% of children between the ages of 3 and 14 who suffer from conditions such as OCD, Tourette syndrome, ADHD, sensory issues, and a host of other behavioral and emotional disturbances. PANS is thought to be the result of bacterial infections such as strep throat, Lyme disease, mononucleosis, mycoplasma, and even certain flu viruses, where the antibodies produced by the body attacking invading bacteria mistakenly attack the basal ganglia in the brain, which interferes with normal brain function. And the types of symptoms from which a child suffers depends on which portions of the brain come under attack.
As a father of a child with PANDAS, I see the impact the illness has had on our son. It is clear something triggered these new movements and behaviors. As a physician, I feel the need to understand this condition better to help my son and other children who are suffering from what seems to be a much more common condition than what had been previously recognized. As a researcher, I see the need to define this condition clearly, identify all the triggers, and find real solutions for patients and their families. Yes, it is debatable, and the names keep changing, but absolutely everyone agrees on the need for more education and research into the causes and cures for this puzzling condition. This key may literally unlock the secrets of most of neuropsychiatry.
Fortunately, there are doctors out there who are learning to effectively treat PANS. Some of the current treatments include long-term administering of antibiotics to deal with underlying bacterial triggers, the use of certain types of steroids, and in extreme cases, administering blood products through an intravenous immunoglobulin or IVIG procedure.
Once PANS was considered to be my nephew Ben's diagnosis, he was given a 5-day steroid burst. Within 2 weeks after the burst, Ben's symptoms drastically subsided for several days and then returned in full force. This pattern was significant because it showed that once brain inflammation was reduced from the steroids, his behaviors went back to normal. As the steroid left his body, the brain inflammation returned along with the irrational behaviors. Ben's parents chose a treatment with IVIG, intravenous immunoglobulin, to eradicate the inflammation permanently. It was a painless procedure to reboot his immune system. 6 months later, Ben said his world was now quiet. His OCD-type behaviors and habits disappeared. His anxiety greatly diminished, and he was finally able to return to school and live a normal life. He is now a vibrant, athletic, normal teenage boy. He is a lucky one.
The parents of children suffering from the symptoms of PANS know all too well the heartbreak of this condition. The PANS-affected child is increasingly isolated from friends, family, and the world. The symptoms affect a child's ability to go to school, to maintain relationships, and to live the kind of life that other children and their families take for granted. Here are some of the symptoms of PANS that you should be aware of. Obsessive-compulsive behaviors, motor and verbal tics, ADHD symptoms, separation anxiety, mood changes, sleep disturbance, nighttime bedwetting and/or daytime urinary frequency, fine gross motor changes, joint pains. This is a great start, but to really make an impact and take the vital steps needed to help diagnose and treat our children affected by PANS, we need your help and your support. Please join us in support of PANS research. Your donation, large or small, will go a long, long way in helping us find treatments for our children and help bring our families back to normalcy. And if your heart leads you, we're asking for your active support in our efforts to expand the awareness of PANS and its devastating impact on our children and families. Thank you.